one of the great failures of our pandemic response was the reluctance of public health officials to admit that the virus had a very specific bullseye. And so eventually it started to come out, and it was becoming unmistakable that comorbidities were driving the pandemic. Comorbidities such as obesity, and here you see the results of a CDC study saying that 78% of COVID patients that were hospitalized in the US were overweight or obese. And this type of information really should help fine tune the pandemic response. Even when we look outside of the United States, places like Italy, Lombardy, Italy, northern Italy was hit unusually hard, but the evidence was very clear that in the lower age ranges, there was largely insignificant risk. It wasn't until you started getting into the over 70. So here in this breakdown, roughly 86% of COVID deaths in Italy were individuals over 70 years old. And again, this type of information is absolutely vital in crafting an intelligent pandemic response. Is it okay to keep children out of school, for example? And I think the Scandinavian countries prove to us that keeping children in school is not dangerous, but other parts of the world did not follow that type of advice, and I think their children suffered, for example. That's just one of the many specific examples to show how our pandemic policy failed to recognize the incredible age stratification of this disease. So in addition to age, obviously, as I already mentioned, obesity is a big thing. And this PNAS paper clearly shows on the y-axis, you're looking at exhaled particle counts, and on the x-axis, you're looking at BMI age. And so no surprise, the super spreaders were basically both high BMI and high age. So the older and heavier you were, the more likely you were to be a super spreader of the virus. And what was ironic and sad at the same time was that the pandemic policy actually caused people to gain unhealthy amounts of weight, thereby making them more susceptible to the virus. So here you can see, more women, 45% reported weight gain than men, 40%. But men reported an higher average weight gain of 37 pounds on average, compared to women gaining 22 pounds. And again, 10% gained more than 50 pounds during the lockdowns. Again, we're increasing the risk of infection and bad outcomes with our very pandemic policy. And other researchers started joining in on this and finding the same things. This is a Johns Hopkins study. Lockdowns only reduced COVID-19 mortality by 0.2%. Again, they should be rejected out of hand, according to these individuals who had done this extensive study. But the collateral damage spreads pretty far beyond just children being kept out of elementary school. One of the biggest killers year to year is tuberculosis. Kills millions of individuals every year, and it's been doing so since antiquity. The arrow that I put here illustrates my point. TB services are among many others were disrupted by COVID-19 pandemic policy in 2021, and its impact on TB response has been particularly severe. So I've spoken to colleagues whose TB wards, for example, had been closed down to allow for, not closed down, but closed down to TB patients to allow for an overflow of COVID patients, which in most cases never showed up. So imagine telling a TB patient that you can't come in for your, year-long, and again, TB is a slow-growing bacterium that requires a long regimen of antibiotic chemotherapy. And to put people on hold for that often meant that the individuals were off track and basically more likely to develop drug-resistant strains of tuberculosis. So again, our COVID policy increased damages to the tuberculosis infected individuals. Another example of that is malaria. Malaria kills hundreds of thousands of children every year. So on a years of life lost calculation, malaria is far deadlier than COVID. Again, in terms of years of life lost, when you've got hundreds of thousands of children that are being killed by malaria, and on the flip side, a disease like COVID that's killing mostly older individuals, the trade-off is not warranted. So as you can see here, we had malaria relatively under control in terms of, keeping the numbers at a fairly consistent level. But this bracket right here shows you what happened after the COVID policies were put in place, lockdowns and so forth. Here's deaths, and here's, again, cases. These are primarily from the 11 highest burden countries for malaria. One of the biggest reasons for that is that insecticide-treated nets in these places were not distributed during, or there was less frequent distribution of these really important interventions during the pandemic. So insecticide-treated nets were not being distributed, and here you see in some places none at all were distributed, and as a result we got this increase again, and many of these are children. Another area of collateral damage was the impact of the pandemic on opioid overdose deaths. And so this is just data from one county in one state in the United States. This is Milwaukee County of Wisconsin. And you can see where the lockdown order went in, and then obviously mental health issues started rising, and along with those issues of loneliness and boredom and all those types of things, you see fentanyl-related overdose deaths increasing, spiking right after the lockdowns. And again, these are not 90-year-olds with COPD. These are mostly 20-year-olds that would have skated through COVID. So when I criticize the lockdown response, I often use Florida and Sweden as my model. And so here's an example of that. Florida versus California, two very different pandemic responses. But when you look at their epidemic curves, these are per capita cases, they're virtually indistinguishable. And obviously there's a few instances where Florida did a little worse and California did a little worse and so forth. But for the most part, they're pretty much intertwined. And then when you contrast that to the economic impacts, where there's a huge gulf. And again, this is based on unemployment insurance claims, which is one metric in the economic impact assessment. But you can see it's a very huge difference here. And I can't overemphasize the fact that economic impacts affect public health. So when the economy is bad, people's livelihoods suffer and their longevity suffers as well. And of course, if you needed any more sort of direct evidence that the pandemic response of California, which was excessive in my opinion, versus Florida, was problematic, you can see that people actually left these places in California and moved to Florida at an unprecedented rate. Some people have said, well, the death rates were different, and California outperformed Florida in terms of death rate. But when you do the actual work and the important work, which is age adjusting the COVID deaths, it's clear that California did worse. California generally has a younger, healthy population compared to Florida, which gets a lot of retirees, particularly from the East Coast. But when you factor that in and age adjust for that, then you clearly see that Florida outperformed California, even in that metric of age-adjusted COVID deaths. This was a study done by the National Bureau of Economics Research, the NBER, and what they did was they graded every state based on a few metrics. And some of these include unemployment and GDP and the amount of in-person schooling and age-adjusted COVID deaths, etc. And so again, Florida ended up earning an A in their metric, Whereas California, which again adopted a much more draconian set of policies, landed down here with an F. And you can take a look at the top 6 states here. So Sweden, again, as I said, was my other model for why lockdowns and that type of draconian policy making failed. This is an article from Science. The premier journal Science was already bagging on Sweden. Obviously, they started taking a political bend on this topic. The country's pandemic policies came at a high price. Okay, and again, they're highlighting the fact that Swedish people just didn't feel the need to wear masks. Again, masks were optional. They were suggested but not mandated. Swedish restaurants stayed open, but they eventually trimmed down the number of people you can dine with. But outdoor activities, they had sporting events, everything pretty much stayed open. There was a few things that they did differently. High schools and colleges were online, but the youngsters, the elementary school students still went to school. But the bottom line is, after the dust settled and after everybody kind of maligned Sweden, we find that Sweden wins. The country that refused lockdown and kept schools open has the lowest pandemic mortality in the world. So these data came out in 2022 showing that Sweden was near the bottom, depending on what metrics you use, at or near the bottom of the entire European Union in terms of excess deaths in that 2020 to 2022 timeframe. Meanwhile, countries like China, which were literally barring people in their apartments, literally bolting them in, having clearly the most draconian policy of all, were still dealing with spreading COVID late, into 2022. And so, more recently, everybody else had been kind of done with it. Sweden in particular was basically done with COVID. And these guys were still trying their zero COVID policy, and which resulted in political unrest, protests in the streets and so forth, which is very unusual for a place like China, which tells you how bad things had gotten despite their overzealous zero COVID policy. So when we look at excess mortalities and deaths from all causes, if you compare Sweden to its true cohort, okay, a lot of the criticism that Sweden received was that, well, look at how well Finland did, and look at how well Norway did. But there's a couple things to consider here. And Anders Tegnell, who was the architect of the Swedish pandemic response, said, with its larger migrant populations and dense urban areas, Sweden is actually more similar to the Netherlands and the UK than it is to other Scandinavian countries. So those comparisons to Norway and Finland were not fair. Helsinki and Oslo are far less dense than, say, Stockholm is, just as an example. So when we compare excess deaths between Netherlands, Sweden, and the United Kingdom, Sweden, largely outperformed these sister countries. No question about it. You can see the data are very clear. So again, the pandemic response using lockdowns as a way to slow the virus did not work.